Thank you very much. We have a gentleman, Dr. Ron Codario, here today from West Penn. Well, he's from the Coalition. He works in a particular local hospital. Ron, you want to come forward? Dr. Codario. Thank you.
Good morning, everyone.
Good morning.
So I'm here representing the Western Pennsylvania Coalition for Single Payer Healthcare, as well as Physicians for a National Health Program, as well as Healthcare Now, member of a few organizations. Before I get started, I'd just like to say I'm honored to be a part of this panel of speakers. It's been wonderful so far, and I wanted to thank Congressman Conyers for exactly what I'm going to be talking about today, which is his bill, H.R. 676. Universal single-payer health insurance, national health insurance, expanded and improved Medicare for all. We can spend all day talking about the how and the why of single-payer, but we're not going to do that. The question I want to ask today is a very simple question. What's the holdup? Why don't we have this yet? Single payer, this bill is going to cover everyone in America for everything that they need. Inpatient, outpatient, emergency, psychiatric, dental, prescription coverage, everything they need. It will allow for free choice of doctor and hospital. Free choice, not like, oh, you can go here, this one covers you, but this one doesn't, this state does. No, free choice. It's going to save us hundreds of billions of dollars every year by eliminating the administrative waste of private insurance companies and by allowing for bulk purchasing of pharmaceuticals. And from my perspective, it's going to allow me to care for my patients, and it's going to allow all doctors to care for their patients without the complicated and intrusive restrictions of private health insurance, which, I mean, as you can tell, as I hope you can tell, I'm a young doctor. It hasn't been that long for me, but it's already wearing down on me. It's a real burden working for a system that is this dysfunctional. I hesitate to call it a system. So I ask again, what's the holdup? 18,000 people every year, probably more since that study was done years ago, dying every year because they don't have health insurance. 50% of bankruptcies due to medical expenses. Not to endorse this bill is really to abandon hope and change for American healthcare. This is the solution right here. We have it. And we don't have to reinvent the wheel. This is it. It's Medicare. Medicare for all. And with 2/3 of the public supporting national health insurance in multiple nationwide surveys, honestly, not to at least put this on the agenda, in my mind, is equivalent to thorough corruption by the private healthcare industry, or simple cowardice. I mean, however you want to look at it. You pick your poison. So I say, endorse this bill, stand up for true universal health care, or be a coward. I mean, that's really what I'm here to tell you.
We'd like to thank Dr. Codario for his prescription for America.